Hi, this is Dr. Charles Krieger from Krieger Health Solutions. I want to talk to you today about the opiate or opioid situation crisis as it is. I know I've spoken about this before, but since we spoke about it last, there has been more activity going on. More states have filed suit against Purdue Pharmaceuticals, the creators of the primary opiate drug, OxyContin. And we also see more states providing care for those who are addicted. We see more activity in our legislature. Here in Georgia, there have been a number of different forums at different places regarding this crisis. And I just wanted to speak about it again because while I do appreciate and applaud the desire, the work toward helping those who are addicted to come to grips with their problem, seems to me that it's as important, in fact more important, to prevent further addictions from arising. Now, that's not going to occur if all we do is switch people from one form of medication to another, which, believe me, is on the radar of Big Pharma. This is a bump in the road. You know, they've been giving out OxyContin and shucks, you know what, that didn't work the way we wanted to, but here's a really great new drug that we can give people and we promise it's not going to be addictive. Yeah, okay. I believe that, and I believe I'm going to grow more hair tomorrow morning. All right, it's just not the way things are. Drugs are drugs. Do they serve a good place in society? Absolutely. If you're dying in agony, you want something to take the edge off. But you can't use that as a means of fixing the problem. If I have a leak in my roof and my solution is to put down a bucket every time it rains, okay, for that moment, I'm not ruining my floor. But the leak in my roof is getting worse and worse with each successive rainstorm. And the same thing is true with the cause of back pain, which is the number one reason people are prescribed opiates. It's back pain. Back pain, dental work, post-surgical. Well, guess what one of the most popular surgeries that require opiate drugs are? Back surgery. Why do they require opiate drugs? Because back surgery has a really abysmal track record of helping people with back pain. Sometimes people are better for a month or 6 months, and then they're back where they were before, because no matter how skilled, how well-meaning, how honest, how honorable an orthopedic or neurological surgeon is, they may not actually get to the root of why the person has pain. So, what we want to do then is create a shift in the discussion that we are having, which is away from what fancy new drug can we come up with to what really works. And what really works for back pain is chiropractic adjustments. I am not suggesting that chiropractic adjustments are relegated to back pain. In fact, we probably have a better track record of success with other issues like childhood ear infections or allergies or headaches. Having said that, what we do works better than what anybody else does on back pain, including acupuncture, physical therapy, exercise, and the whole panoply of different things that are in the non-surgical realm. Not that those things are bad or don't have a purpose, but when it comes to back pain, the chiropractic adjustment is supreme. So, what I'm asking is this. Number one, people you know who are in pain, refer them for chiropractic care. That's what they require. It's like if you have a toothache, going to a podiatrist isn't going to make a big difference. All right? That's just how things are. If your car doesn't run right, you're not going to go to your gym trainer and ask him about your car. It doesn't work that way. You go to the person who does the job. Pills don't work, at least they don't work in the long run, and the other modalities are beneficial, but only in the short term. Anyhow, what I'm suggesting is this. We're coming up on an election season. You want to find out how trustworthy your officials are? Pin them down on this issue. What are you doing about the drug problem? What are you doing to ensure that people suffering with back pain are referred from their primary physician to a doctor of chiropractic? What is your game plan, Mr. or Mrs. Legislative wannabe? What is it you're going to do? What are you going to do to help prevent our citizens from becoming another statistic. The way to do that is make policy that has medical physicians referring their back pain patients to doctors of chiropractic. If you get hemming and hawing and eyeball rolling and, well, blah, 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 from your legislative wannabe person, well, then you know that they're shoveling something that cows leave in the barn. All right? So, just to sum up, this is a serious problem. It's costing us billions of dollars a year. Worse than that, it's costing us tens of thousands of our fellow Americans' lives, shattered families, etc. There are few things actually worse than having an addicted person in your family. I know it, other people know it, it's all around. We should not be contributing to it by shoveling coal into that furnace and finding a new drug that has no purpose when chiropractic adjustments are already here and have a far, far better proven track record. This is Dr. Charles Krieger, leaving you with that thought. If you have comments, want to comment to me on that, you can reach me at my website, www.kriegerhealthsolutions.com.